So this kid came in, like, we'd probably see 6, 7, 8 cases of this a day. Really nothing, I mean, pretty extensive burns, but would get better. Like, we'd anesthetize the kid every other day, do dressing changes, treat with antibiotics, treat with nutrition. You got to give these kids vitamin C, otherwise their wounds don't heal. I mean, things you just don't think about in the United States. Like, you don't think, okay, I'm going to treat this wound, but I got to give nutritional supplementation, otherwise the wound won't heal. So anyway, this kid was getting better, and I love it when they get better because those are the cases you just cling to. And the mother took this kid to a traditional healer. Just took the kid to a traditional healer, and the traditional healer took off all the dressings and rubbed cow manure in wounds because cows are sacred animals. And the kid came back and got septic and died. And I remember talking with the mother saying, because, you know, for me, like, traditional healers in a lot of the places I've worked, sometimes they're blessings, sometimes they're curses. And, you know, and I always try to advocate for the health of the patients in the community. And I talked to them and I'm like, well, why'd you do this? They said, well, the child seemed to be getting better and I wanted the extra help. And I'm like, well, don't you think this may have caused the child to die? No, this was God's will. All is as God wills it to be. And that's one of my ghosts, so to say. Okay, this is a woman here. You can see the beautiful ornamentation on her abdomen. People have the ritualistic scarring. And what I drew there with my black pen is her spleen. She had a disease called Kala-Azar, or visceral leishmaniasis. Visceral leishmaniasis is it's a tropical disease spread by the sandfly. The standard of therapy for this disease is using what we call SSG, sodium stibogluconate. It was a medication designed in the 1940s, and it has a 10% mortality due to heart side effects. But because North Americans and Europeans don't get this disease, there is no research going for anything better. So the best medication we used was designed in the 1940s. And if you do go to the MSF website, go to the Essential Medicines program, where you can see some of the advocacy that goes on to make sure that diseases like Kala-Azar, like visceral leishmaniasis, get research funding, because their lives are valuable too. This here is oral rehydration. Any of the doctors in the room ever seen this work? ORS is designed by a Harvard chemist like 10 years ago. This stuff's magic. These kids come in dehydrated from diarrhea. Diarrhea kills more kids than anything else in the world. And they look like they're about to die, and then you start rehydrating them, and they're like Lazarus kids. They just pop up. And it's interesting because with OR rehydration, as well as with our high-energy milk, we would have the mothers feed it to them. Like, here's us demonstrating to the mother how to feed it to them. I remember we had a kid with diarrhea. I just didn't think this kid would survive. And we tried putting in an NG tube to resuscitate the child because the child was so weak it really couldn't swallow. But the mom had a spoon, and we told the mom to give a sip of this oral rehydration every 2 minutes. And of course, no one has a watch or a clock, so the mother would sing a song. And when she got to a part in the song, she'd give a teaspoon of this oral rehydration. And she stayed up all night singing. That kid made it. Wet season, dry season, again, this is a country where there's no roads. So when it rains, it sucks. People don't have access. They don't have access to healthcare. They don't have access to education. But in the dry season, all of a sudden we had masses of people come to our clinic. So, and we don't turn anyone away. We don't say, hey, we're full, sorry, go to the next place. We're it. So we had a lot of patients in the dry season where they'd come sick and we say, we don't have a bed for you, but you can sleep outside and we'll still give you treatment. And there she is sleeping outside. And you can see family members preparing their food. It's just day-to-day life in the clinic, you know. Kids, you know, this is my good friend Paul's a photojournalist. We were just talking about on the way over here, like photographs of kids. It's like you can't take a bad picture of a kid. Logistics. So this face, by the way, Sarah gave to me for 9 months. Seriously, Jason, what do you need now? Logistics is everything. Logistics is everything. Keeping the shelves stocked with antibiotics, making sure that we order things months ahead of time so that we don't run out. Everything. In fact, our polio vaccination campaign, just to give you an idea of how important logistics is, we did a combined vaccination campaign with the WHO and with the Carter Center, pulled our resources and went door to door to vaccinate. And 3 days into the campaign, we realized that the cold chain had been broken at some point from the shipment of the vaccine from Geneva to Kenya to Sudan. It went 3 days without refrigeration, so we had to start from scratch. And these are things you don't think about in an American hospital. Like, well, this vaccine needs to be refrigerated. What if it went a couple days without refrigeration? So logistics, if I had to choose between 20 doctors and one logistician, that's an easy decision. Easy decision. Logisticians are worth their weight in gold. This is not a drug deal. Once a month, we paid the staff. And, and I, as the doctor, I was counting money, and it was interesting because, we're going to talk about malnutrition in a bit. During the hunger gap, the time just before the harvest, people were starving. And we were paying our staff in money. And like James Toots, Stephen Quell, the leaders in our clinic came to us because what had happened is because of all the violence, the roads were not safe to travel, so the trucks that would bring food were not coming. And there was a month where our staff came to us and said, can you pay us in food instead of money because there's no food in the market to buy? And again, it's like, I don't know how many of you are business owners or have employees. I hope you never are in that situation where an employee, someone that you're responsible for their well-being, has to be in that situation to ask that of you. And here are the family members waiting to get their weekly rations of food. And giving the weekly rations of food. This is USA donated and WFB donated corn soy blend. And we'd give them a bar of soap once a week so they can wash their face, wash their clothes. Antenatal care, I didn't take pictures of childbirth because I always had my hands dirty. But one thing, again, we're way more alike than we are different. Mothers love their kids. Mothers always want to do what's right for their kids. And I can tell you this, that we live in a world where pregnancy is not a risk to life. I saw in my 9 months of Sudan maybe about 20 women die in childbirth. And again, you walk out feeling, God, I'm a bad doctor. If I'd paid closer attention in medical school and obstetrics, maybe I could have made a difference. But you hate the circumstance. You hate the circumstance. So we would try to get women to come in when they were pregnant to vaccinate them for tetanus, to check them for syphilis, to check them for malaria, to give them prenatal vitamins, good prenatal care. And the way we bribed them and incentivized them to come to clinics, we'd give them mama kits, right? And this is the contents of a mama kit. Everything you need to have a home delivery. You got gloves, you got string to tie off the cord, you got soap so you can wash your hands afterwards, you got a pad for bleeding, cloth to wipe the blood off the baby, a blanket to wrap the baby, and a big plastic sheet to put on the floor of your tubal. The problem we had was these razors, these sterile razors to cut the cord, would get stolen. The men would take them and use them for haircuts. And why is that important? It's because of this. This is neonatal tetanus. It's one of the #1 causes of death in children under 1 month of age. And it's caused by, typically, the umbilical cord being cut by dirty instruments. These kids typically come to the clinic with the chief complaint of not feeding well, and then they progress to this, and it's usually a bad sign. 9 months there, I saw maybe 3 or 4 cases a week of neonatal tetanus, and I saw about 7 or 8 of them survive. So, and it's just that they call it the rhesus sardonicus, the smile of tetanus, where all of the muscles in the mouth clench up. The kid just clenches and like this, and it's just an ominous, ominous sign. And now, as a physician now in the United States, and I have a lot of new age hippie friends who say, you know what, I don't believe in vaccines. I just don't believe in them. I could quote the science because the science is very sound, but after seeing what I've seen, I don't have the capacity to even enter them in dialogue. I'm sorry, I can't talk to you about this. I think you're a bad parent, and I think that you're human. I think that you're hurting your child and putting your child in harm's way. And it doesn't take many cases to see it. This is an interesting case. This is a little kid that has this weird rash around the mouth and kind of weird bone structures. This kid has a neonatal syphilis, congenital syphilis, acquired it from the mother.